Good afternoon and welcome to Bariatric Friday. This is the right place to be and on a Friday afternoon. So as usual, we are here. My name is Kemal Erkan. I am the chairman of American Surgery Center, and I'm here with Dr. Isaias Irgau. This is our weekly event. Dr. Irgau, how are you doing?
Great, Kemal. Absolutely the right place to be on our Friday afternoon. Another session of Bariatric Friday. Lovely to be here. Thank you.
So what happens now, like some of our friends who are not part of the business, they also know this so that they're watching. Now, they call some of the other days with their own topics or their own whatever they want to do. So now we may be the trend setter. So now everyone is going to call different days for something. So, but
nothing is going to match Bariatric Friday, though. I can tell you that.
It's like Diabetes Monday or like the hypertension Tuesday.
We will always be the first ones,
right? So,
and we claim that spot.
Our goal is to bring the awareness on morbid obesity, and not just morbid obesity, but obesity overall, and make sure that our patients, they understand what's available for them. There are other people who may not be our patients. They also know what's available for them. And also patients who may be going through the program, pre-surgery, they can watch some of the episodes and then they can find some topics very important for them, and people with the post-surgery. There are so many different ways to benefit from these sessions, and we are proud of the work that we are doing because, again, time to time I mention this, but having a medical profession who's one of the best in his specialty being available for us. I mean, we are not sponsored by any of the, big TV channels or like big companies. So we are doing this on our own with our limited resources. So, but the important thing is what we are able to provide and make it available for those who are struggling with obesity and morbid obesity day to day, every day, and see how we can actually help them. Today, we want to cover one of our regular topic is the bariatric surgery and the patient perspective. So this is mainly what you may be getting by getting into the program, how you are making this decision, the things that we need pre and post surgery, emotionally, whether or not you are ready, the day of surgery, pretty much the whole program, kind of, but from the patient perspective. So, Dr. Irgau, you would be the best person to answer or put some of these in perspective for the patients. So, because that's one of our goals. So, if you would like to start, that would be great.
Yeah, no, absolutely, Kemal. So one of the things that, we learn over years of practicing bariatric surgery is obviously to understand the perspective from the patient's point of view. And of course, the most pervasive aspect of this is that they are struggling with obesity. And obesity is not a neutral issue, as you know, and as we've spoken many, many times. Obesity not only comes with the physical limitations that it burdens the patients with in their daily life, or the medical and health issues that it comes along with, like diabetes, but also it comes with a terrible, terrible stigma associated with it, right? Where people are looked at and immediately identified based on their weight as somebody who is obese. And with them will come different preconceptions and different ideas of the people around that in one way or another actually influence the way the person feels, the way the person lives their daily life, right? And over the years, listening to patients opening up about really their struggles with obesity, I have learned a lot, Kemal. I have learned a lot about patients who really felt terrible because they would take their child for rides, in some summer place, and yet they cannot accompany their child in their rides because they cannot fit within those rides. Or they would go to a meeting and they would have to stand up because there would not be a chair that would be comfortable for them. Or they would actually go to meetings earlier than anybody else, so they would be able to find a chair that would be fitted for them, right? All struggles really that eat away the person's confidence, the person's really outlook in life as well. And it's no surprise that many of our patients also struggle with mental health illnesses, whether it's depression or anxiety. So that's really the perspective that we find, Kemal. But then obviously, the other side of the story is that we are able to help. We are able to provide relief, in the form of bariatric surgery, which is the most effective treatments that we have. And I see these two sides of the story play out day in and day out during my office hours, Kemal. I mean, literally in the same day. So, like yesterday, I would see a patient who is about 5'2" in height, so very small frame to begin with, but whose weight is 330 pounds. So let's just imagine what life is like for a person like that, right? And then, of course, it's easy and tempting for people to look at that person and say, oh, well, they haven't done X, Y, Z, that's why they are in such a situation. Well, that's actually not true. What we know right now, Kemal, is that people who get to that level of obesity get there because their biology drives them to get there. One of the stories this patient told me, and that really made them really decide to confront this issue and try to get help, is when over the last summer, they gained 35 pounds, right? Just like that. Right? Now, gaining 35 pounds over a number of years might be an experience that many people may be familiar with, but to gain it over a summer, come on. There is no way a person is eating that much to gain that much weight unless their biology is driving them to get there. Different times of our lives or different individuals have a genetic predisposition that assigns to them a certain weight. That's called a set point, right? And many people actually know that no matter how they eat or how active they are, for a number of years, their weight actually fluctuates within a certain level, and then it suddenly may go up at some point, but it stays constant. The reason it does that is because there are powerful biological drivers that really set the weight at that point. So for a patient to gain just like that 35 pounds, that driving biology is the main reason why that's happening, right? So you see a patient with a weight of 330 pounds at 5'2", that gives them a body mass index of 60 kilograms per meter square, Kemal. I mean, we call the definition of morbid obesity is a body mass index of 40 kilograms per meter square. Now imagine 60, right? And this is not a patient who is very old. This is a patient in their 30s who has a professional life, who is actually associated with healthcare in their life. So it's not that they don't understand what needs to be done. It's that they are fighting a biology that cannot be solved with the usual things that we've always been told, which is diet and exercise continuously. So that aspect of obesity we see, and then at the same time, Kemal, I see a patient that we operated in the American Surgery Center 6 months ago, right? That patient comes in with a weight loss of 100 pounds over 6 months, right? And the patient is obviously all smiles, all happy, all committed. And the stories they tell me are not ones that are depressive stories. The story they tell me is that, you know what? We were at a function with my spouse the other day, and somebody passed right across me, and they asked my spouse where I was, right? They couldn't recognize them, and they obviously defined how great that feeling was, right? So these two aspects we would see come out, two aspects of how patients perceive it when they're suffering with morbid obesity, and then when they are liberated from morbid obesity through bariatric surgery.
So again, we are trying to see this from the patient point of view perspective. Sometimes, you probably know this the most because you probably spend the most time with me among my friends. So I always use this perception versus perspective. So we are talking about perspective, and I was just double checking if I put it right in, because sometimes like we kind of we go between the two terms, and many people they have a perception rather than having a perspective of the issues. And this is again where we make where it becomes more difficult for those individuals, because the decision of surgery, like you mentioned this event, someone was going there, and like what we understand is all of us, you, me, and others who may, have the who may be struggling with obesity or not, we always make adjustments based on how much we walk, how much exercise we do, how much we eat, when we eat. So, and we all have good and bad habits. So, as you know, I always volunteer my own confidential, issues from my life in this event, just so that people understand that this is real. So, like last night, we went for an event. We went to this event. A couple of people from my office, they were with me, and then if they are watching this, which I know that they are, so they will know that I was cheating before I left my house. So this was at 6:45, 7. So we were there probably by 7:15. One thing that I knew, that there were alcohol in this event. So then I don't eat anything throughout the day. So then because of the intermittent fasting, again, now, like, look, the life is already kind of put it in different, like my days already kind of in different segments. So they're almost 12 to 2 p.m. I don't eat anything. So that puts me almost like 15 to 17 hours fasting.
Mm-hmm.
But I still have to, prepare myself for this event, not to worry about what to wear, but how I won't actually get drunk, because with the empty stomach, if I have one or two, it will make a difference. So I have to prep for that. Mm-hmm. My prep is having 3 egg whites. Mm-hmm. So now, one, it didn't actually, it hold me up, because I also don't want to eat there. Now, I'm gonna, again, I will be honest. So at the end of it, what I ate wasn't maybe something that I would be proud of, but I was able to go through that trouble of the event food and also prep for what I may be drinking. So then I'm prepping myself for what's coming. Mm-hmm. So this is kind of maybe the perspective that we need to make people understand. So this is like, you estimated my BMI the other day, somewhere from 29 to 30, and it's probably around like 29 these days. Mm-hmm. So, and I don't feel like I'm close to that other side of it yet, right? Mm-hmm. But then if you ask me, that's so far away from me, but it's really not that. So right. Because I still have the same clothes, the same size that I'm my dress size didn't change. Mm-hmm. I may be able to gain, maybe I might gain 25, 30 pounds, where I'm still able to fit into the same clothes. Mm-hmm. So that's the kind of like the perception becomes the reality in some cases. Like you are thinking that, oh, well, I'm still size 54. Mm-hmm. Well, but now maybe you are more full in that 54 than before. Mm-hmm. So then you are creating a perception in many cases. But my point by sharing this yesterday, I had to prep for that upcoming mm-hmm. event. Mm-hmm. And this didn't include anything regarding how I'm going to look, but it was more about what my body mm-hmm. needed. So then I didn't want to just eat some of the food that they had there. Mm-hmm. And again, so at the end of the night, maybe I could have a little bit better choice. So I won't mention what I ate, but you get that from your kids every once in a while when you leave Saturdays, Friday meetings. Mm-hmm. So play don't go too. Mm-hmm. So, mm-hmm. But maybe I failed at that point, right? But mm-hmm. I know that I did really good up to the point of that time. So mm-hmm. that was 9:15. Mm-hmm. So, and if I didn't have those 3 egg whites, mm-hmm. it could have been even worse. Mm-hmm. So there is this prep that's required for all of us. So that's one thing that I want our patients or people to understand. So this is not about this individual or that individual. One of the people who were with me, and just because she may not want to mention, she may not want me to mention her name, she says Monday through Friday she does CrossFit. It's like weekdays, Monday through Friday, 6 a.m.
Yeah.
She's almost at a pro level tennis player, and she's in great shape, but that requires her to get up at 6 to do CrossFit training.
Yep.
Is it CrossFitness or CrossFit?
CrossFit. Yeah, you're right. Yeah.
For an hour every day. So you see like how much. And then I was, one of the observations that I'll tell you, she didn't make the same mistake that my other employee who was with me, he and we kind of failed, but she had only one of the things that we were eating. We had three different items. She had only one. So then I see that as like, okay, so this is how people are also, we make our choices. I could have not done what I did, but if I didn't see what she did, then I wouldn't maybe even have this talk today. So this perspective point, we really need to have a heart-to-heart talk. So put our head in front of us and then say, okay, what's going on in my life and what's going to happen if I go through this program? So we just want to kind of like put that out there for our patients.
So that's a very interesting point, Kemal, and this is really right at the heart of the perspective of our patients and also the community, society at large has about obesity, right? We think that our body is neutral when it comes to weight gain or weight loss, right? That is really the fundamental framework with which we look at obesity. We say, okay, you know what? If you do XYZ, you will lose weight. If you do XYZ, you will gain weight, right? Actually, it's not true. Our body is not neutral when it comes to weight. Our body is designed to favor weight gain by far over weight loss. And we all know this. And you actually very much exemplified this with what you just said, right? When we try very hard to lose weight, Kemal, and we stay disciplined, whether it's doing CrossFit, which is extremely hard and requires a lot of discipline, or do intermittent fasting, for hours on end when you're surrounded by food continuously, this requires a lot of things. The actual result in terms of weight loss is minimal, right? The minute you fail only one day, the weight gain is much, much higher. In other words, it takes one weekend of failure, right, to regain the weight that took you 6 months to lose. Just think about that, right? This is what we are fighting against. So when people look at individuals who are struggling with weight, they look at them as individuals that are isolated. They are part of society. They live in a society which has plentiful of food, which is surrounded by food, which is surrounded by functions where you are really set up to fail every single step of the way, right? It is in this setting that we have to try to understand why our patients are struggling, right? So the perspective they have, and I started this, I know the discussion is about perspective, but I introduced the issue of perception as well, because that's integral to the perspective as well, Kemal, right? So if you start out by saying, I am struggling with obesity purely because I am a failure, because I haven't been good enough, I haven't been disciplined enough. Every time somebody lends you a hand saying, look, come on, I will rescue you, will say, no, I can do it by myself. If I accept your hand, it means I am failing. And that's how a lot of the patients who struggle with obesity, including that patient I mentioned earlier on, who now has a BMI of 60, has looked at bariatric surgery all along. They looked at bariatric surgery as a cop-out, as a way to get out, right? Instead of understanding that really they are dealing with a disease, as many times we've said, right? Of course, if that patient had high blood pressure, diabetes, or cancer, they would have no qualms about going to somebody and asking for a hand to be lent to them to get help, from the professional. But when it comes to obesity, we don't. And that perspective is very important in really understanding why is it when there are so many millions of people who suffer from this disease, only a fraction of them are actually seeking this treatment that is so effective and present right now, right? And that's an important perspective for us to understand, Kemal, because unless we understand that and convey that, and through this type of discussions, obviously, convey that to society, we are not going to be able to make a dent, in the situation, of course. Oh, yeah. Once the patients make up their minds, they have crossed that line, they've understood, right? And they've committed themselves to that help. And then when they do it and they go over bariatric surgery and they've lost all this much weight, then you ask them how they feel and they say, I have one regret, and that is, I didn't do this years ago. I didn't have to suffer through all these years and get to this point before. But the reason that happens is because the perspective they have of their own condition of obesity and of bariatric surgery are skewed towards identifying them as the culprit, as the person who's bad, as the person who is weak, and society is not helping in that sense, obviously. And then as looking at bariatric surgery as a cop-out instead of as a really bona fide treatment that really is effective in addressing morbid obesity.
So one thing that I want to share, again, knowing and what may be going through in our lives, right? So I just want to share this screen, and I just want to make sure that I share the right screen. So what you see here is my diet intermittent fasting journey. So, and this is just September, and it tells you number of hours that I go through. So what you won't see here is the weekends. But Thursday, Wednesday, Tuesday, Monday, last Friday, and Tuesday. So that means either I didn't enter some of them, or I didn't do it. So, and as you see, like this is yesterday, and then I put that yesterday just because, and it tells me how many hours I was fasting, and then averaging is about 16.3 hours. So this is not something that I'm like dying to do every day, but it's a necessity for me.
Yes.
Because if I don't have a good record keeping, then I don't know where I'm going to be. So, and I want to take care of my body as good as possible. And like this, what I was showing, it can be done in any kind of like an application that you can actually use. But again, putting this, my main goal for the perspective point is we all go through this. So we are all cheating on food or fitness. No one is dying to just go and work out for 2 hours or 1 hour every day. Walking in some days is not as much fun as the other days, but you have to find ways to push yourself. And if I don't do it, as you were just saying something earlier, everything that you do Monday through Friday can be wiped out on the weekend if you don't carry some of these good habits. And we all struggle with this. So now, you and I, we are at a point where we can actually, maybe our troubleshooting doesn't have to be as severe as others. Like we are talking about patients who are BMI 35, 40, 50, 60, 65.
Yeah.
So, and what can help them is not what I'm doing, not maybe just the fitness, not this and that, but with all those, they need to have the most efficient tool, which is this surgery. So now, getting to that and making sure that you have right settings, you surround yourself with right people, including your family. It's an education. Everyone needs to actually go through this. So if you are struggling with this, so one of the things that I want to make sure that also our patients have this discussion with their close friends and also their families, just without actually shying away from the maybe embarrassment, because I'm not saying that they should be embarrassed. I'm just saying that maybe they are embarrassed to discuss or be so open. But have this heart-to-heart discussion with them and sit down and tell them what you want to achieve, what your goal is, where you want to be, your ideal state. Your ideal state is you want to be healthy, not like you want to be skinny. You want to be healthier, right? So and your closest friends should not be a spectacle of this. They should be supportive. And if they don't, get rid of them. So get rid of them, because that means they don't want you to be healthy. So now, again, like some of the personal anecdotes are maybe fun, but I know some of them are crucial. My dad, it was, for me, it was eye-opening when he just bluntly said, that when I thought that I was actually doing better, he said, well, you need to lose at least 30, 35 pounds. I'm like, oh my God. And then he was right. So I need him on my side.
Right.
I don't want someone who's going to say, oh, well, you didn't eat today. Oh, well, you should be okay. And then next day, you are 10 pounds up. And then they're going to be the first one who's going to make fun of you. So no. You need to have the right people on your side. Right people is people who understand what healthy means, like healthier means, because this is why the perception is kind of like putting people in trouble, because they think that this is a cosmetic surgery that you are going to look skinny. No, this is all about your health. So the resources is another thing. So until 2.5 years ago, we didn't have any of these videos out there. And I may be a little bit biased on this, but because of my surgeons who are committed to this event, but also because of Dr. Irgau being available every week almost, we are putting a lot of things out there. So from the resource standpoint, you have more resources than you had 3 years ago. So now, we in some of these topics, it was repeated 6 times. So we put them in good, playlist, easy to watch, and then they're available. And we work on this closed caption, like the subtitles. We had them in Spanish. So this is now more resources. So there are more things available from our side for our patients, for the community, actually, not just for the patients. So what else, Dr. Irgau?
So, I mean, you've said it, right, Kemal? We have to be here to support, to let patients know that it is not necessarily something that should feel them weak or undisciplined just because they have struggled and have failed to really defeat this problem. And that is because there is biology that is intrinsically resistant, and it makes it very, very hard for them to be able to lose weight, particularly when the weight gets to certain levels, right? We talk about a body mass index of 35, body mass index of 40 or above. Once you get to that levels of weight, Kemal, not only is extremely difficult to come down, no matter how hard you try, right? But that becomes a platform for easy weight gain afterwards. Just like the example I was mentioning about the patient gaining 35 pounds over the summer. It is because obesity by itself becomes a platform for further weight gain, right? So the more weight you gain, the easier it is for you to gain weight as well. In that situation, it is very, very understandable why so many people are failing when they just are trying with diet and exercise, right? So bariatric surgery has never been safer than it is right now. We talk about procedures like gastric sleeve, gastric bypass. The level of safety that we have achieved with these procedures is comparable to things like gallbladder surgery, knee replacement surgery, hysterectomy, which are procedures that are considered relatively safe, in people's minds, so that when they are recommended, people would most likely go ahead with them. So if you look at the long-term, medium and long-term consequences of staying obese, right? The number of illnesses that will accrue, the discomfort that it causes on a daily life, the mental anguish that it creates by living with it, when you compare that with the benefits that you get from surgery, from bariatric surgery, so effective, so powerful tool that we have right now, it should be a no-brainer. But obviously, the perspective is what determines whether people will ultimately decide to come or not. And I do think you are absolutely right with taking time to have discussions like this out in the public is actually helpful, Kemal, because it will give an insight to this world, which may be completely unknown to many people. You know what I'm saying? When they talk about bariatric surgery, it may be such an alien concept that they reject it immediately. Their family rejects it immediately. Oh, so-and-so had bariatric surgery. And they look at it as something so esoteric. And yet there is nothing more useful and important than bariatric surgery in current day medicine, Kemal, not only because it helps people to regain their life, but also because it can tackle so many diseases at once. You know, somebody who's struggling with obesity, but also diabetes, high blood pressure, and sleep apnea, with one surgery, all those illnesses could be tackled. So looking into bariatric surgery, coming for a consultation to see if, they are candidates is an important thing. They can come to our website right now. It's actually fairly easy to make a consultation appointment at any time of the day right now, actually, with the changes that we have come up. They can come and we can discuss. It may well be that they are not interested at this stage, but at least they should have that information about their own health and the importance of the role that bariatric surgery could play in their treatment.
So that's absolutely right. So when you look at on Facebook, we have this support group. It's a private group, so you have to be a patient of CREAS in order to be part of it. Mm-hmm. So, but again, the new stuff that I'm looking at, one of the patients 5 days ago, they had sleep surgery, and in 4 months now, finally out of the 200s today. So heaviest was 280. Now they're down to the goal is 170. Now they're at 198. So they lost 82 pounds in 4 months. So another patient, she put all of her pictures. So it's like, we are not paying these individuals, right? So they want to share this because this is a big achievement. And
it is.
And like she's saying that first time posting with pictures, my progress. Heavy is 233, and she's down to 135 pounds. So, how can we tell the story in a better way than the actual story from the patient? So, knowing that this is an outpatient surgery, so remember, you are going to be home on the same day. Mm. So, it's kind of like many people still don't believe this, but 99.8% of our patients, out of 400, maybe 2 patients, and they didn't stay because of the clinical reasons. They didn't have, they had some last-minute caregiver issues. They go home 6 to 8 hours after surgery. So this is that simple. So we made actually this simple because in the hospital setting, this is still you have to stay overnight, at least 1 day or 2 days. But in our program, this is perhaps the best program in the United States in this setting. So it is, we customize this in the best way to make sure that there is the best outcome in the safest way with the most experienced people. So your decision from the process of the surgery should be much easier than it was maybe 5 years ago. So, and that's why we are here, and hopefully we are able to reach out to more people. Just, join us with the support groups. I think one of the things that Dr. Irgau, you said, it's really important. Just be open-minded and come for a consultation. And then you can say, well, this is not for me now. Yeah. But then now maybe you have a better understanding of why it needs to happen. And maybe you'll do it 12 months from now or 2 years from now, but then it will open up the research process for you to actually watch our other videos in different topics, because there are so much to learn. And if you're able to do this, if we increase the awareness of the issue of morbid obesity, and then somehow you were one of those magical people that you lost 100 pounds by walking 2 hours a day, good for you. So you don't have to have surgery anyway, right? So our goal is not to get you to a surgery. Our goal is to open up that communication channel so that you understand that there is a help available. There is a very powerful tool available. And there are other things, in magical situations can happen. So that's pretty much what we are trying to say today. Well, Dr. Irgau, thank you again so much for joining me, and we'll be back next week with different topics. And until then, please stay safe and have a great weekend. Bye-bye.
Bye-bye, Hannah. Have a nice weekend. Bye-bye.